The March test, also called the Gillette test, is a motion palpation test to assess movement at the sacroiliac joint during hip flexion. Anteriorly, the SI joint is a synovial joint. Posteriorly, the sacrum and ilium are connected by the interosseous ligament and form a synarthrosis joint. The SI has a small amount of movement. Estimates range from 0.5 to 8 millimeters of translation motion and 1 to 8 degrees of rotation motion around the lateral axis. During the March test, the patient is asked to stand on one leg and flex the other thigh up towards the chest. As the weight of the spine descends through the SI joint and standing lower extremity, the sacrum stays relatively stable. The innominate of the flexing leg should rotate slightly posterior during the hip flexion action. By palpating and observing the PSIS on the same side as the hip flexion and the S2 spinous process, the therapist is able to assess motion at the SI joint as the patient moves. Structures that could contribute to the hypomobility of the SI joint are the interosseous ligament, the short and long dorsal sacral ligament, which become taut when the innominate rotates posteriorly during hip flexion. Tightness of the gluteus maximus and erector spinae muscles, which attach to the ilium, sacrum, or surrounding fascia, could also contribute to SI hypomobility. Indications to assess the SI joint with the March test include pain in the lumbar, hip, iliosacral, or pelvic area. Contraindications to the March test include the inability to stand on a single leg due to weight bearing restrictions, balance problems, lack of strength, or for any other reason. The March test should also not be performed on patients who have hip precautions that prevent them from being able to flex past 90 degrees. Motion palpation tests have been found invalid for the identification of SI joint dysfunction. However, they are still widely used in the clinical setting. Specifically, the literature has found conflicting evidence on the reliability of the March test. Carmichael, who modified the test to raise the knee as high as possible, found high inter-rater and intra-rater agreement. Others have found fair to substantial intra- and inter-rater reliability. Mihenji et al. Executed trials of various palpation placements and found no difference in reliability, and speculate that diminished range of motion at the SI joint is difficult, perhaps impossible, to palpate. In order to perform the March test, the patient stands with their feet shoulder-width apart. The therapist palpates the PSIS of the side being tested and the spinous process of S2. The patient is then asked to bring their leg of the side being tested up towards their chest. The therapist is able to palpate and observe movement of the SI joint. This is then repeated on the other side to allow for a comparison. Lack of inferior movement of the PSIS joint on the side suspected of having a dysfunction would be considered a positive test, and indicates hypomobility of the ilium on the sacrum. We will now provide an example of how the March test is performed. Hi Andrea, my name is Alexia Nichols and I'm your physical therapist today.
Hi, nice to meet you.
Nice to meet you. How are you doing?
Okay. I have that pain, like we were talking about,
Just
really low.
that lower back area.
Exactly.
Okay, so today what we're going to be doing is a test to see, show you our skeleton here, see how your pelvis is moving on your sacrum.
Okay.
And I think what's happening is there might not be enough movement in there, so it's kind of just stuck.
Okay.
So what I'm going to be doing is I'm going to be feeling right here, it's called your PSIS,
Okay.
and then on your sacrum, so right here,
Okay.
it's level S2, and then I'm going to be asking you to march, and that should cause that pelvis to just rotate on the sacrum.
And it might not be.
And it might not be. So then I'm just going to be able to compare the two sides
Mm-hmm.
to see if that right side is moving a little bit less.
Okay.
Alright?
Yeah.
Okay, so what I'm going to have you do is I'm going to have you go ahead and stand up.
Okay.
And you can face the door for me. And then are you okay throwing your shirt up?
Yeah,
Just a little bit, just so I can see.
Mm-hmm.
And I'm just going to put my hands on your hips.
Okay.
And just turn it over. And then you can go ahead and march that right leg.
Yeah.
Do it one more time. Let's do it one more time again. And I'm just going to go over to this other side.
Okay.
You go ahead and push that left leg. And do it one more time. Perfect. Alright, well it looks like they're both moving the same for the test.
Okay.
So we consider that a negative test.
Okay.
Good to go.
Okay, thanks. Thanks.